Assalamualaikum and good evening. My name is Nuraini binti Tajuddin, CAFF 233, student ID 2021 and 19647. Today my topic is to pursue my audience to get vaccinated. COVID-19 can bring open serious life-threatening complications as hospitals like UAB are seeing in hundreds of patients daily who need hospitalized care. Even though it affects certain groups less seriously than others based on age, health, and other factors, it is still not possible to predict how COVID-19 will affect any individual. Getting COVID-19 may offer some natural protection known as immunity, but experts do not know how long the immunity lasts, and the risk of several illness and death from COVID-19 far outweighs any benefits for natural immunity. Getting vaccinated creates an antibody response so that you are protected without having to experience the illness. Both natural immunity and immunity produced by a vaccine are important aspects of COVID-19 that experts are investigating. Healthcare officials and agencies plan to keep the public informed about new development. So, you are fully vaccinated and you can start doing more activity like we used to. After you are fully vaccinated for COVID-19, you can resume many activities that you did before the pandemic. You can resume activities without wearing a mask or staying 6 feet apart, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. People are not considered fully vaccinated until 2 weeks after the second dose of the Pfizer, BioNTech, or Moderna COVID-19 vaccine, or 2 weeks after a single dose of Johnson & Johnson COVID-19 vaccine. You should keep using all the tools available to protect yourself and others until you are fully vaccinated. Okay, so we go. Question by the community. It will inject a microchip to Bill Gates so Bill Gates can track your every move. It will turn you into a monkey. It will alter your DNA. It will allow Russia to spy on you. These are just a few of the crazy conspiracy theories circulating on social media about the COVID-19 vaccine. Governments are not only waging a war against the virus, but a battle with misinformation as they look to roll out vaccines, while in UK, the government is battling against the vaccine hesitancy over more legitimate concerns around safety, and critics arguing regulators have approved the Pfizer-BioNTech vaccine too quickly. Indeed, in a recent study by the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, only 54% of the UK respondents said they would definitely take the COVID-19 vaccine, and this dropped to 47.6% after viewing misinformation on social media. And people from lower income, Black and ethnic minority backgrounds were least likely to go and get vaccinated. So how do government overcome the barriers and persuade the public that the vaccine is safe and they need to be vaccinated? This is where insights from behavioral science can help governments messaging and present a more powerful and persuasive case for vaccination. This will take more than logistic and simple messaging. Only with a behavioral approach as part of the program will the system deliver the 80% coverage needed to gain herd immunity. As part of the UK's National Health Service NHS COVID Behavioral Change Unit, I have been detailing the behavioral science inside the policymakers will need. We have developed evidence-based behavioral policies for each of the priority groups: care home residents and the over 80s health and care workers, the over 60s and young people. Our research has found that across all the population cohorts, there are significant potential barriers to taking the vaccine, ranging from anxiety to determined resistance, mild skepticism, to overt mistrust and disinterest to conscious non-compliance. For instance, young people are highly skeptical and more likely to believe false information such as that seen on social media that the vaccine includes a microchip to track your every move or that it contains tissue from an aborted fetus. So we go. Care home residents and over ethics. The barriers to take up in care homes is the anxiety about being one of the first to take the vaccine, a feeling that they are the country genia pigs. There is also a question of trust. Many of those in the 11,000 care homes across the UK have mental health issues or complex medical needs, with 40% of residents suffering from dementia, and so they rely on the familiar face of staff. This is where the messenger effects on help. A well-researched phenomenon is how we trust the message being delivered more when the person conveying it is like used or an authority figure. Thus, it would be best if care home staff were trained to administer the vaccine or non-GPS. But if this can be done, then trusted members of staff should accompany the immunizer. Line non-staff were strangers to reader residents. Also use non-local GP surgery staff and other nurse community staff. We respond well to incentives, so rewarding those vaccinated with a badge will appeal to our powerful ego, which can only be nudged by providing care homes with a certificate from an official body recognizing when all residents have been immune. Social norms are also powerful drivers of behavior, thus producing a chart that the public can easily follow, showing how many people have been vaccinated each day. Will active this and show we are all in this together. Over the 65 years, is the fear of the vaccine greater than the fear of the virus? This is consideration for the over 65s and particularly relevant for black and ethnic minorities BME who were perceived as higher risk but have not caught the virus. Indeed, research shows vaccine hesitancy is higher among BME groups and lower income households and with diminished levels of education. Using trust channels such as faith groups, charities and community groups is important, as well as using messaging that taps into the effects bias to evoke an emotional response, such as over 65 are over 3 times more likely to die if you get COVID than someone younger than you, and use traditional media such as newspaper, billboards, and broadcasts alongside digital channels. So here we go to young people. This group range from teenager to 29 and they are least likely to become severely ill, which may lead to a complacent attitude to receiving the vaccine. However, if herd immunity is to be achieved, it is vital they participate. Social media is a key communication channel for them, so employing the messenger effect with influencers to champion the vaccination is vitally important. Research has shown how much of an impact social media influencer opinions have, and it will help dispel the plethora of misinformation and conspiracy theories. In conclusion, a COVID-19 vaccine is a vaccine intended to provide equal immunity against severe acute respiratory syndrome coronavirus to SARS-CoV-2. The virus that causes coronavirus disease 2019 COVID-19. Prior to the COVID-19 pandemic, an established body of knowledge existed about the structure and the function of coronavirus causing the disease, like severe acute respiratory syndrome SARS and Middle East respiratory syndrome MERS. This knowledge accelerated the development of various vaccine technologies during early 2020. The initial focus of SARS-CoV-2 vaccine was on preventing symptomatic asymptomatic, often several illness. On 10 January 2020, the SARS-CoV-19 genetic sequence data was shared through GISAID, and by 19 March, the global pharmaceutical industry announced a major commitment to address COVID-19. The COVID-19 vaccines are widely credited for their role in reducing the spread, severity, and death caused by COVID-19. So that's all for me today. Thank you.